Hey everybody, welcome back. It's Dr. Matthew Hertert here again with Centre Chiropractic in Boalsburg, Pennsylvania, just outside State College and Penn State University. And today I want to talk to you for just a few minutes about physical therapy or physiotherapy and how that relates to chiropractic, with a little bit of background on the profession, some details about what I do in practice, and then for those of you out there in the world who are not near central Pennsylvania, some real important basic biomechanics that's important to understand to take good care of yourself, help with posture problems, recovering from injuries, or just being self-advocating in a healthcare context. So first I want to point out that what physical therapy, what that term really means, is working with soft tissues. So that can be muscles or ligaments, sometimes tendons and fascia, but really mostly muscles and ligaments are where the focus is. And the intention there is always either after a trauma or a surgery to help the muscles stay long, flexible, and well hydrated, because their tendency is to kind of shorten and dry out after a trauma, or to fix muscle imbalances, whether they're a product of spinal misalignments or a cause of spinal misalignments, to really unwind the system there and get better posture. So that's really what that term physical therapy means or addresses or refers to. And I think a lot of people don't know that doctors of chiropractic have extensive education in this. We get the same sort of basic elements or basic ingredients that physical therapists do in their curriculum. I imagine we spend a lot less time actually practicing that stuff in the curriculum because that's not our primary focus. We also have to study the adjustment, and we're primary care physicians, so we have to learn all the pathology and diagnosis and that sort of stuff too. But we get the same information or exposure to the same ingredients there. And along those lines, a lot of chiropractors have the same resources in their office that most physical therapists do. I think few have exercise equipment, but most have hot packs and cold packs, therapeutic ultrasound, muscle stim, just like I do here. In all honesty, in my practice, maybe 2 or 3% of my clients ever even know that that stuff's in the building. It's just not necessary in most cases in my clinical experience. Sometimes if somebody's had a real severe injury or anyway, it really is rare for me need to bring that stuff out to use that with people. The two major components of physical therapy that I do a lot of in practice in here, and I think you'll find more commonly in most chiropractic offices, are soft tissue work, massage basically, and then stretching and strengthening exercises. Now the massage it's not exactly a spa treatment. It's really clinically indicated. It's got a therapeutic intent. It's a therapeutic procedure. We're trying to break up spasm, scar tissue, other kinds of adhesions in the muscles and ligaments so they can function better. The reason that's so important is they're what hold the adjustments in place. So on a side note here, in school I was I viewed myself as somebody who was a real student of classic chiropractic. I was all about the adjustment, fixing the misalignments, getting the pressure off the nerves so the body can heal itself, to the degree that I went to well over 24 very expensive weekend seminars while still in school. So this took a lot of time and money away from my other schooling, because I was so focused on being as good as I could at that, because that's the most important thing. All physical therapy aside, the chiropractic premise works. If you get pressure off the nerve, the body will heal itself. And oftentimes, like with a rotator cuff problem, a lot of times that forms in the first place because there's a power connection here. Your shoulder can't talk to your brain can't coordinate your shoulder, so it's weaker and more subject to injury. So that's always true. The chiropractic premise is foundationally accurate and true. The icing on the cake there, if some 72-year-old woman wanders in here with a rotator cuff problem and she's suffering, I'm going to educate her about that so she understands how important that is, and that this probably stemmed from the nerve pressure, and we're going to fix that. But I'm not going to tell her that she has to just suffer and wait for her body to fix that in time, which is certainly going to happen more slowly in somebody who's older. I'm going to do everything I can. I'm going to give her every resource to also help that secondary health problem heal more quickly. So that's really why I do this physical therapy in practice. And I have a lot of respect for chiropractors who don't, again, because the adjustment really works. So that's a little bit of information or perspective on there are some professional and philosophical reasons not all chiropractors do physical therapy. And certainly there are some physical therapists who do adjusting, which they shouldn't do because it's not in their scope of practice. But it's a complicated relationship there, and it's not really important to this conversation. The other thing I want you to understand about the physical therapy, really for the people out there who are not central to central Pennsylvania here, not near central Pennsylvania, has to do with the muscle system and basic biomechanics here. And this work is really based on a medical doctor named Janda He's a European medical doctor, and my understanding of his story is that his last year in school, he became very interested in physiotherapy, and that's primarily what he did in practice. He did very little else as a medical doctor. He was really focused on physiotherapy, and in his first 10 years, he made some really important discoveries that he then published, so the rest of us had access to working with this stuff. And what he discovered or uncovered was that as you look at the body from the side, there are two major subdivisions of the muscle system that kind of crisscross the body like girders. The first set are called the postural or tonic muscles. They're the bigger, stronger, beefy muscles I think most people think of when they think of muscles, like calves, thighs, one of the ones in the buttocks, the ones down your spine, your pecs, your traps, SCM. So they literally give us posture. They hold the skeleton erect. The other set, the set that sits across from them, which are antagonists or stabilizers, are called the phasic muscles, and they by nature are 30% weaker. That's what you'll see in any textbook. Now, because we sit down so much, I mean, there are side-to-side imbalances too. They're usually only a byproduct of major structural differences, like a dramatic scoliosis, a big leg length difference. The reason so many of us are in need of this front-to-back work is because we sit so much. Our bodies are walking machines. We've been hunters, fishers, fisher people, gatherers, hunters, as long as we've been on the planet. It's only the last 50 years we've all been sitting on our backside all the time. And that is like trying to take an electric toothbrush and jackhammer a hole in the sidewalk. It may work in time, but you're going to have a lot of degeneration and stress on the tool, on the machine as a result of that, and the body is a machine. So the easiest way I think to show this is the most common example or the most frequent example. I talk to people about this all day, every day. This is very much in the forefront of my mind, and still at lunch when I'm sitting and doing paperwork, I catch myself doing this at the computer. I think most of us who sit in front of the computer have noticed that at some point or another. Now, whether it's because of weak muscles or you're trying to see the screen better, it doesn't matter. What happens is it puts a tremendous amount of stress on the bottom of the neck there. I always knew sitting up was important because my parents and teachers yelled at me, just like everybody's parents and teachers yell at them to sit up straight. What I didn't realize till I got to med school was how significant this difference can be. When your shoulders are back and down where they're supposed to be, and that opening in your ear is right over your shoulder, the PSI, the pounds per square inch pressure in that bottom disc in your neck is 14 pounds per square inch in the average person. When your head moves an inch and a quarter ahead of that, which is not very far, that pressure in that disc goes up to 42 pounds a square inch. That's a huge increase in stress on that area. So your body does a really wise thing to try and prevent subluxation, dislocation of the joint at the bottom of your neck, herniation of that disc, moving into arthritis right away. Your body uses the only resource, which are muscles, because ligaments don't contract. And within the muscle system, it uses the only ones it can use, which are those big, strong postural muscles to clamp down and contract and try and prevent that joint from moving further out of place. So now these muscles are working way overtime. That's a really wise decision on the part of your body. The unfortunate long-term consequence of that is that the weaker phasic partners now can't exercise. All right, so they're already weaker. Now they're being overrun and overpowered all the time, so they can't exercise, so they start to get weaker, so the area gets less stable, so the body turns up the posturals, so the phasics get weaker, so the area gets less stable. So it's this kind of downward spiral where we go from nice Greek statue posture to potato chip shape like so many of us have these days. So this can be worked with, and the process is to first take time stretching the posturals, and once you get to a certain point of progress, to come in and strengthen the phasic muscles. And they will also hold the adjustments in place better. I've seen a lot of people over the years who are getting adjusted sometimes once a week, you know, for extended periods of time, and they're being sent right back out in some cases to do, you know, work-related activities that get them out of whack in the first place, and no attention is being paid to the structures that hold the adjustment. So that's another level on which it can support and help the body recover more quickly. So this relationship is what's really important to understand anywhere in the world as a self-advocating client. And I encourage anybody to be self-advocating, even my clients, without being belligerent or, you know, obnoxious or challenging. I, at least once a year, get somebody in here who's been seeing a physical therapist for some sort of problem, sometimes another chiropractor, but often a physical therapist, who's getting worse. And when I asked them about what the treatment protocol there was, the answer every single time has been that they got stretching and strengthening exercises at the same time. Now, if we take a step backwards and you think about what I just described to you, the only reason you would seek to strengthen a weak phasic muscle is because it's weak. If it's weak, it can't do its job properly. So if you ask it to do a job, because it doesn't know you're trying to do a strengthening exercise, for all it knows you're trying to fight off a predator or get food into your mouth, right? Your body is going to do whatever it has to do to get that job done. So in that case, it is going to have to go back and continue to over-recruit the big, strong muscle that it's been overusing all this time, which is already too strong. So if you start strengthening too soon, not only are you not going to strengthen the weak thing, you're going to end up over-strengthening the thing that's already too strong, thereby making the problem worse. So it's a really important process to understand. And I encourage you, if you find yourself in that situation, chiropractor, osteopath, physical therapist, whoever it is, just gently inquire. Have you heard of Janda? Do you know who he is? What his theory was? Do you disagree with that? Have you found something better? If you found something better, please, post here and let me know, because I'm open to anything that works better. So that's the overview there of all this stuff. Again, I know it's an overview. If you've got specific questions or inquiries or comments, you can post them below the video here. I'll check in with those as frequently as I can. In the meantime, you can always email me or call me, wander around the website, check out the blog, subscribe to the free email newsletter. You can call our awesome staff at 466-2000 to set up your first appointment. If you're trying to get out of pain and you're having problems with this kind of soft tissue related stuff, or if you just want to avoid it because everybody in your office has had it, you'll be glad you called. And thanks for your time. I hope it was helpful to you. Blessings to you and yours.